So yes, there are a number of things that you can do to treat certain things in your nose that don't involve surgery or rhinoplasty. So you might have heard something like non-surgical nose correction or liquid rhinoplasty. So basically all that means is we're taking a tiny little bit of filler, and you must go to a board certified provider for this. And we're using it to address certain issues that people might have with their nose. The best thing that it can help is somebody who have maybe like a little bump. My patient here, she's got a gorgeous nose, but that could help if you did a little bit of that little filler there to help it, be a little bit straighter. It can also, if used sort of in the nasal bridge in this area here, it can be used to make the nose appear maybe narrower. It's not going to be something that if somebody has like a wider nose that they want, that's going to be surgical, or something that's really, asymmetrical. Of course, you're going to have to go and get surgery for that. But there's little tweaks that we can do that can actually make a big difference for patients. And in fact, we can also use Botox or other neurotoxins to really easily change little things about the nose. So for instance, right here we have a big muscle called the procerus. You want to pull that up for me? Yeah. And so that can pull down or pull up the nose. So doing a little Botox there can help to soften that. So give a little lift to a patient. Also, there's another muscle here called the levator labii superioris aliquot nasi. I got it out. It starts here, originates here, and it kind of comes down all the way here. So you may have heard of Botox treatments for gummy smile. That's actually done right here because that muscle that I just mentioned pulls up our mouth. So if you do a little bit of toxin there, it can help to kind of bring that down if you have a gummy smile. Another thing that we do for the nose in terms of Botox is right here. We call these bunny lines. Yeah, perfect. So injecting a little bit of Botox there is helpful. That's the nasalis muscle, and that pulls us up. So sometimes people can look a little wider if that's really sort of worked over and thickened. So doing a little toxin there over time can help to sort of narrow that area. Another area that people like to treat is the alar part of the nasalis. And this is an area where, if a patient has a little, try to flare your nose for me. Yeah. So if they have a little flare of their nose that they don't like, that's, a great place to do a teeny bit of Botox just so that they're not flaring so much. And then finally, we have a muscle here, under here, which is, we call that, it treats something called the nasal tip flip. So if somebody, especially as we get older, we start to kind of lose collagen there. And a lot of patients will notice that when they smile, so give me a big smile. So she's young, we don't say anything, but sometimes the tip of their nose can go down a little bit. So releasing that with a little bit of toxin can help. So when you smile, the nose doesn't go down, but kind of stays, naturally up. So again, there's a lot of non-surgical, easy little tweaks that you can do to improve the appearance of your nose.